Welcome everybody to another World of Nutrition with the infamous Marilyn Lemire from Hawaii. And we have two great guests today, Vince and Dr. Mischa. I didn't want to put your name, but this is on the World of Ability podcast network. Thank you to Marcus Hart, Jay Stoyan, Aaron Swingate, Zach Clayton for putting it on their platforms. So now I'm going to pass it over to Marilyn to get us started. And who are our guests today, Marilyn?
Thank you so much, Emily, and welcome everyone to the World of Nutrition podcast. We're so thrilled to have Dr. Mischa and Vince here today. So I will let Dr. Mischa go first. Dr. Mischa Pakata, she graduated from Cleveland University, Kansas City in 2020. She has honed her expertise in chiropractic care, specializing in restoring balance and vitality to her patients. Having worked in various locations across Hawaii, including Haleiwa, Mililani, and currently serving the communities of Ewa Beach, Wahiawa, and Nanakuli with Kingdom Chiropractic, Dr. Mischa has gained valuable insight in the diverse needs of her patients. In addition to her chiropractic practice, Dr. Mischa also shares her passion for wellness as a yoga instructor at Powerhouse IAEA. By integrating chiropractic principles with the ancient practice of yoga, she empowers her students to cultivate physical strength, flexibility, and inner harmony. Off the professional front, Dr. Mischa leads a fulfilling personal life, happily married to Dr. Nate Davis, who is also a chiropractic. They form a power couple in the world of holistic health. Together, they create a supportive and nurturing environment for their patients' healing journey. Dr. Mischa's love for nature and adventure draws her to activities such as long forest hikes, beach outings, providing a refreshing balance to their busy professional life. And as a dedicated lifelong learner, she finds solace in reading, constantly seeking new knowledge and insights to enhance her practice and improve patient care. Thank you, Dr. Mischa, for coming, and we look forward to hearing from you.
Yes, thank you so much, Marilyn. And it's wonderful that you have this platform to, kind of share more information and connect individuals. It sounds like we're not just people in Hawaii right now, right? There's some people from the mainland here. Yeah, awesome. Yeah, thank you so much for the intro. Like Lemire said, my name is Dr. Mischa, and I'm currently practicing in Ewa Beach, Nanakuli, and Wahiawa right now. And I've been a part of the communities here for the last year. And what sets our practice apart, I think, and what I strive in my practice as a chiropractor is really making it patient-centered. Everyone comes from different walks of life. I treat a range from pediatric care to geriatrics, full family spectrum. And, I can attest that everyone has very unique needs. And so my goal in practice is to meet patients where they are and find ways that we can support them on their healing journey. Chiropractic school is a doctorate degree. It's kind of like a bit long, but the reason it's so long is knowing when we can help people and when we need to send them away. And so I definitely I love that, we've all met and connected, because there are some things that I like to, use network and have a big support system for healing someone, and it sometimes takes a village. And so I definitely recognize all of the strong bridges of communication that are only going to help and support my communities I'm in. I know, speaking with Marilyn for the past couple months, we met through a Business Network International on the West Side chapter and got to talk with her about what her passions are. And it seems like a lot of it is focused on family health. And so I wanted to speak on how chiropractic care is beneficial and really helpful for pediatrics and prenatal care and just family care in general. Personally, I've been treating all ages since I started. I think I always had a passion for, anyone who's looking to improve their health and maybe get over any conditions that they're suffering from at the time. But children are very unique in that we don't even think about all the falls and spills that you have happen to you while you're growing up. I wasn't lucky enough to go to a chiropractor when I was younger. I actually found it in college when I was training jujitsu and competing in undergrad, and I injured my neck and I wasn't able to turn past here. So I was like driving to the appointment. I had heard about chiropractors. I was technically studying for pre-physical therapy and I was already in the health field. So I was aware that, chiropractors can help the spine. And as I was driving, I was like trying to look behind me and not get in a wreck to my appointment. And it was crazy. Like one session, my neck was like, at least like 90% restored like mobility, and the muscle tension was calming down. I had a few follow-up sessions. I wasn't the best patient at the time because I was a broke college student and I always was like, I got it. But it's been interesting, the journey. And, I always like love when parents bring their children in younger because, you learn more and you do better. I think as chiropractic as a profession, we're into like kind of integrating a little bit more with bigger Western medicine institutions. You're seeing us in VA hospitals. We're getting more into military posts and also like more referrals from medical doctors because there's a big recognition of the pharmaceutical companies and the pharmacy epidemic of just like everyone's just giving you pain medication, and people are getting addicted and they're not really having the positive side effects that you want as you're healing. And yeah, it gets you out of pain in the moment, but what does that, how does that wreak havoc on your systems? And so, it's wonderful to see that there is like a new wave of health that's coming through. And, I'm excited to be on that wave of like, I think the generation that I'm in, because speaking to chiropractors that have been in Hawaii like for 30 years, some of my mentors, they saw that fight they had to do to kind of get ahead on conservative pain management. And so it's a constant battle. We're still kind of fighting on legislation too for making sure insurances cover chiropractic care and making it more accessible to you. And that being said, with chiropractic care for children, sometimes it's difficult because, they might be coming in for different reasons. I know a lot of people associate chiropractic care with back pain. And yes, there are a lot of studies that we do help with lower back pain for sure. But it's really cool to share some studies that are coming out for infants and, pediatrics, especially, that are showing that it helps with colic, improving ear infection, improving breastfeeding difficulties, helping, asthma. So a lot of these more like full systemic issues that can happen, supporting their nervous system as they're developing. There's been really cool studies that are being done about like ADHD in children and how chiropractic care has shown positive cognitive function as well as behavioral changes. And it's at this like interesting point in the profession where we're still having ongoing studies always, but the ones that are coming out are really amazing to see how that's supporting that journey for all ages. And it's tricky. I tell parents a lot of the time, whether they're bringing in their baby or, their elementary kid or teenager, a lot of the times it's hard to read what is going on. When you're an infant, you're just crying for everything. So it's hard to determine, like, is it something they're eating or is it, what's going on? So sometimes too, it's like supporting their rest, supporting their nervous system, and the moms and fathers who are dealing with the stressful baby so they can rest too. Because it's wreaks havoc on everyone's nervous system, I think, when people aren't like sleeping well and their immune system's depleted because they're not sleeping and they're taking care of their child too. In terms of prenatal care and helping support mothers even after birth, postpartum care, it's really beautiful to see. As when you're pregnant, you can't have a lot of painkillers, even like simple NSAIDs, you need like to be more particular about what you take. And so what's beautiful about chiropractic care is it offers a conservative approach to pain relief and really helping the alignment of the pelvis. We have this really cool hormone called relaxin when we're pregnant that floods the system and then really helps to stretch the ligaments of the pelvis. Our body knows what it's doing to allow for the childbirth, but sometimes it just needs a little guidance. And so just adding that extra phase of treatment for mothers to build their support system and listen to them, how they're feeling, and build that connection they have with their own bodies. Because it's, a beautiful process and they're creating life. It's a lot going on internally. Sometimes they just have to take a step back and then rephrase how they're thinking of, what their exercise looks like, what their, self-care looks like. And so what's really cool about that is, I've had pregnant patients that they've had, really sharp sciatica pain, issues with just sitting and taking care of their existing children and running around. And so it's been really cool to see, after a few sessions and even just one session, they're like, oh, I got to like sit on the floor with my kids and not worry about, not thinking of their pain. So it's still things that I think are big leaps in my practice that I value. Moving up to, how we also help with different conditions like autism and Down syndrome patients. Like, Down syndrome, there's still a lot of studies for both of them in terms of chiropractic care. But from what I can speak on a clinical level from my practice, I've noticed it helps to build that connection with another person, and they connect as well to their bodies a little bit more. Their family members tell me that their mood is stabilized and they, have less falls, they're more coordinated. And so those are the types of things that my practice aims to support for families and for children and as they grow into adults. In terms of, what I like to present for chiropractic care is just kind of understanding that we're more full spectrum. And so I have patients that come in with no pain at all too. So, I treat young kids who are in sports, who are, trying to train for competitions, like whether that be wrestling, team sports, football, soccer, baseball. They all have different ways of using the body. And so understanding how we can properly recover, how we can support the system, aligning those joints in the spine and sometimes extremities to make their sport that much more fulfilling. And what I like, or how I like to explain that is, if the joints are in the ideal position, if they're not being stressed in any way, then they're able to optimally recruit the muscles that you're wanting to use. So for the baseball player that's like throwing a whole bunch of, I shouldn't have used baseball. Let's use soccer. For the soccer player who's like, wanting to work on their kicks, understanding how that pelvis plays a role in the hip socket and the hip joint, when they're going into that full kick and making sure that that can move in that range of motions. Sometimes when you come in, yes, I adjust, but I also aim to educate patients on how to use their body properly and focus on what muscles to stretch, what exercises to do, and, answer their questions as well. So definitely, enhance sports performance, pediatric care. I do have, a lot of people that also just come for injury prevention. I think that's really huge. I work with a lot of like dancers and other types of athletes that they already have a lot of ligament laxity. They have a lot of range of motion. So understanding where to add the strength. And I think as the bigger picture of like what I do as a chiropractor is finding this balance between, does it need stability or does it need mobility? Where in that balance are you at in different segments of your spine, whether that be different muscles in your extremities, and how can you optimize that? So yeah, I wanted to just end with, I think that's 20 minutes. I'm not sure. Give me a heads up if I'm okay. But yeah, I just wanted to share, like I always like post different promotions or events that we're doing. Okay, cool. I'll take that 6 minutes. Yes, I also share that I like to do community events that are free to the public. If you live in Hawaii on Oahu, out in Ewa Beach, I do a lot of collaboration events where I put on free yoga classes for the community in the park. I'm also at the gym, in IAEA and Powerhouse Gym, but sometimes it's a bit more accessible when it's like, we live in this beautiful place, why not utilize the space and be outdoors? And so that's been really wonderful to do. And then what's really cool is we're actually the only chiropractic office. Kingdom Chiropractic is the overarching company, and we're the only chiropractors in Nanakuli and in Wahiawa. So it's really cool to serve more of the locals, I think, because a lot of people don't want to go in those areas, or they don't have those connections. And so it's cool to see. And I grew up in Mililani, and so it's fun to like kind of, be that rival of like Trojans versus the mules with Lelehua. But it's fun to like banter with my patients. And yeah, if you are ever interested or have family members that you think could benefit, you can find me on social media with the Kingdom Chiro HI, or chiropractor_Mischa is my Instagram handle, where I'll do more like personal things. Yeah, if you have any other questions, please, I'll open up the Zoom for any questions if anyone has.
How long have you been practicing out in the West Side?
And so I just started. I've been in Ewa for about a year. I've lived in Ewa for about 3 or 4 years, but it'll be a year in August since I'm in Ewa. And then in Nanakuli, literally this week, I started over there. And so my husband, who's also a chiropractor, he's been out of that office for a year. And so I'm just joining him. So we get to carpool together and hang out and share patient stories and kind of lift each other up throughout the day. So that's been kind of fun. And yeah, that's how long I've been out there, but I plan to be out there for the long haul. So great question. Thank you, Marilyn. Thank you so much for your time, everyone. And please feel free to reach out if you have any concerns or questions or anything at all. Thank you so much.
Thank you. You mentioned your 2 handles on Instagram. Did you have anywhere else that people can reach you at?
Yeah, of course. We also have a TikTok at Kingdom Chiro HI. And then my office phone is 808-445-5477. And yeah, if you look up Kingdom Chiropractic, you'll see where all of our locations are, and you'll be able to book with me online if that's also easiest. And Facebook as well, Kingdom Chiropractic. So yeah, check us out, and we're around.
Awesome. Thank you so much, Dr. Mischa. So much knowledge, and I
Thank
love what
you.
you do to just help the community as well, help educate. So now we
Yeah.
have our next speaker, Vince Abramo. Vince finds joy in witnessing the change of individuals and groups when they are engaged in healthy dialogue. She has a heart for small businesses and supports the mission of nonprofits to fulfill the community needs. She has a master's degree in public administration and a bachelor's in intercommunication and public relations, with certifications in conflict resolution, nonprofit management, and volunteer management from the University of Hawaii. She is a certified coach and trainer through the John Maxwell team, brain health coaching through Amen University, neuroencoding, certified development and leadership coach, and thriving women in business. She resides on the island of Oahu with her husband, Nick, and has 3 wonderful adult children carving their own journey. She tries one scary thing every year and tries one new recipe every month. That can be scary too. I love that, Vince. So please take it away. We're so thankful that you're here today.
Thank you so much, Marilyn, for having me today. I really appreciate you having me. And thank you, Dr. Mischa, for all that knowledge. I learned some things about chiropractor practice, and I didn't know about that whole health comprehensive learning that you are practice that you do. That's amazing. Thank you, Dr. Mischa. So I wanted to talk, since this is the nutrition podcast, I am a brain health trainer with Dr. Amen, and I went through this training to discover how I can have a better brain and how I can work with people. So I used to do mediation in the family court system. And when I saw that the people were not getting what I was saying in the mediation, I said, there's something deeper going on with the person. Of course, I can't start doing that discovery while I'm in mediation. I was trying to get them to either go back to rehab or do anger management, or, like get them in to a place where they can see their kids again. But I wanted to take a deeper dive. And what I discovered through Dr. Amen, I wanted to find out more about what Dr. Amen does, is that he is the ADHD doctor. He's a psychiatrist and a neuroscientist. And my sons have ADHD, and they also have a lot of different learning disabilities. But I have a disability myself, and discovering those and going through a lot of his programs, I'm like, oh, I have ADHD too, because every bright, shiny object becomes a squirrel-like experience for me, right? And how do I heal my brain? How do I heal my family's brain so they can be better at communicating, be better at functioning and having everyday life better for them, so that they can feel that they're more solid, more feel grounded. But when I get through the program, it's all about nutrition, which is wild, right, Marilyn? Right? They go right back to making sure you take care of your body, because whatever's happening in your gut, it's going to affect your brain. So having a good prebiotic I didn't know about phytobiotics. Photobiotic, Dr. Mischa, if you want to correct me, you can go ahead and correct me. But I didn't know about all these different biotics that affect your brain, and it creates those neurotransmitters. And then how we stay in our amygdala. A lot of times we do, especially when in conflict, we're staying in our amygdala brain. We're doing the fight, flight, freeze, fawn response, right? We're pleasing people or we're running away from conflict. But when we push ourselves into the prefrontal cortex, that executive functioning brain, we're actually utilizing more of those neurotransmitters that we have to connect to. So what you find out about nutrition is that the better nutrition you have, the better brain you have. There's a lot of things that we do in Dr. Amen, and we do it the Bright Minds Rules for Brain Health Eating. And we learned about how some of the foods are pretty healthy for us, but some of the foods that are bad for us also affect our brain. So the food that's been bad for us is actually shrinking our brain. And I don't know about you, but I don't want to have a tiny brain. I want to have a big, full, healthy brain. Dr. Amen utilizes SPECT scanning, and that's to see what the blood flow is like in the brain. And he noticed when people were on a bad diet, it does affect how they're functioning, how they're able to get through the day, how do they make executive decisions. So we know that the Western diet is filled with fat, salt, and sugar, right? And eliminating that is so difficult for many people. So as a brain health trainer, I help them to be accountable to taking care of their brain. We know that sometimes junk foods does affect the brain in a way that they can't make good decisions. And then it does affect if you do have ADHD, if you do have any learning disabilities, or even depression, anxiety, it starts to affect your brain, and your brain is not functioning as well. So I'm going to talk a lot about the brain today, because I love talking about your brain. And your brain is the most sexiest part of a human being, because we need our brains to function in this society, right? It makes the world run. We worship with our brain. We communicate with our brain. There are 11 simple food rules. We want to get high quality calories, right? At least 1,800 calories a day. Water your brain, making sure that you get hydrated, have high quality protein, and focus your diet on healthy fats. Eating smart carbohydrates, brain healthy herbs and spices, and making your food sure that your food is clean. So that means organic and from a farm. So I tend to have food that's from farms that are sustainable and that are really accountable to the earth, right? They want to make sure that they're taking care of the animals and the fish that are really are clean for the community, and that they're being responsible back to the earth. And then, of course, checking out your food allergies. creating that elimination diet. What are you really allergic to? And eat for your brain type. So I can provide after, if anyone ever wants to reach out to me, it's on Instagram, TikTok, I don't know, other places that I'm on, I think Facebook, but if you follow me on Bamboo Shoot HI, that's Hawaii HI on Instagram, I'll provide that information for you. And then we also want you to eat from the rainbow. So a lot of vegetables. And what I advise a lot of my clients is to have half your plate with vegetables. If you're going to have fruits, keep it to a part of the day that you like to have fruits. And then giving up, and it's hard because I do drink coffee. I like coffee, but I try to water down my coffee as much as possible. But we know that caffeine does dehydrate, and it also dehydrates your brain. So giving up, if you can, something that may be dehydrating your brain. It might be energy drinks, soda, juice. Dr. Amen hates juice, by the way. He thinks that's so full of sugar, and that's aiding this way of not filling or not having your blood flow good. And so thinking about that too is about what your clean protein resources are. Are there, have eggs, fish that's wild, lamb, turkey, or chicken, and raw nuts. So we're a family of nuts, and we love having nuts nearby. And then high protein vegetables like broccoli and spinach. And of course, we know high cholesterol is not good for your brain. And did you know that low cholesterol is not good for your brain either? So you have to have some good fats. And again, sugar is not your friend. And you want to find out why sugar is not your friend, so that it's not contributing to the health of your brain. And then going back to the rainbow colors, right? Making sure that your food is yellow, green, blue, purple, and orange. If you can name for me after this podcast what the color of your vegetables are on your plate, please let me know. I am curious what the rainbow color of your plate looks like. And some of the things about spices and herbs, garlic and oregano boost brain flow. Saffron actually is a great antidepressant effect. We actually call it saffron a happy spice, by the way. And curcumin decreases beta amyloid plaque, so helping with the plaque in your brain. Rosemary, thyme, and sage enhances memory. Ginger, cayenne, and black pepper boost metabolism, and cinnamon boosts attention. And by the way, it's an aphrodisiac for men. So take some cinnamon, women. And of course, gluten can impede blood flow to the brain. If you are allergic to gluten, please find out, because then that's more serious. But if anything, try to experiment again with the elimination diet and see if gluten may be a factor in having your brain not function the way that you want to. And I will also provide that brain type quiz on my social media. And you want to prepare food at least once a week and have your food to go with you if you're ever going to be out. If you're not like me, where I'm doing everything from home, I can like access my refrigerator right there and create my own food, my salads, my fruits, my smoothies. But if you're out and about, please make sure you pack that, and then you're controlling what you're eating. And of course, remember to have hydration. Hydration is so important. And then omit those unhealthy fats out of your diet. And if you can't take any supplements that may be affecting you, so supplements are very important too. I really am a big fan of supplements, especially Dr. Amen recommends having a multivitamin every day and omega-3. So if you don't do anything else, take those two things. But if you can't take it, I do recommend Marilyn's patches, because I can't take a lot of those joint supplements or even collagen, and that has helped me a lot. And it also helps with your skin, your eyes. But guess what? All of those things are actually helping your brain, and that's so exciting for me. So I hope you and your family and anyone that you know and love has a healthier, fuller brain, and that they fall in love with their brain. Thank you. I'm probably short my time, right?
All good, Vince. Dr. Misha, did you have any questions for Vince at all?
I love everything you said, and I'm showing my lunch has a lot of greens, some carrot, some orange, and some green tofu wrap.
It's
Shout out
healthy.
to Down to Earth.
Oh, yes, down to earth is one of my favorites.
But I love everything you're talking about. It plays in so well, and I'm happy that we were put on the same podcast day because I just like, health is such a full spectrum thing. It's not just like what you do to your body, but like what you put in it. So important. So I love everything you're saying, and I'm so cool that that's like helped you personally too. I loved hearing your story.
And it's a journey, right? Discovering what's really good for your body, what's not good for your body. I'm not the healthiest, and that's okay, right? It's what we can improve on. So thank you, Dr. Misha, for sharing your wonderful. I'm really hungry now for that wrap.
I was like, I probably shouldn't eat while I'm on this, so I'm excited to delve into that after. That's lunchtime for anyone who's doesn't know the time frame, so it's good. Now you've inspired us to eat the rainbow, so it's great.
Eat the rainbow, and that doesn't mean Skittles. That's sugar.
That's true. Yes.
I've heard a couple of experts say that our gut is actually our first brain. What are your thoughts on that?
I'll let.
No, go ahead, Dr. Misha.
Yeah, I mean, I definitely think that's true. I went through like a random period of my life where I was really deep diving into like research on gut health and like the gut brain axis. And it's crazy how many neurotransmitters are created in our gut, which is how we like kind of communicate with the environment we're in. And so yeah, I mean, that's a huge part too of like, are your bowel movements more regular? How's your prebiotic and probiotic game? Everything you were saying, all those things play such an important role.
And I believe your brain is your first brain. Your second brain is your gut. And your third brain is actually your heart. And I just learned that recently. And having a healthy heart too affects your brain. So if you have any heart issues, it does affect that blood flow to your brain. So that was pretty exciting. But I do agree with Dr. Misha about you want to create those transmitters that are going to your brain and that it's functioning well and you're having healthy neurotransmitters.
And Vince, I know you mentioned a little bit on social media. Is there anywhere else that people can find you?
Yes, I do offer classes, Eventbrite, and you can follow me. I think it's under Bamboo Shoot. And most of the time I have free classes once a month. A lot of it is to do with communication and business and sales and things like that, about having healthy boundaries, how to ask for the sale, things like that. But at least two times a year, I do offer Dr. Amen's practice of training your brain to be healthier. So, and I think it'll be the end of October, November. We are going to cover depression, anxiety, trauma, loss, all of those things that people go through before the holidays. They start to remember things and that might be affecting them. And at the beginning of the year, I do offer brain health for people in business, because guess what? You use your brain for business too. So
I have a question. I've listened to Dr. Amen on different podcast platforms, and I'm curious, he's written like a few books. Is there one that would be a good like intro book to read for just delving into that world of nutrition? Thank you.
oh my goodness, there's so many books. And his wife, Tana Amen, also created cookbooks in response to him. So she actually is a speaker too under him. So it's pretty exciting that they get to do it as a couple. But Change Your Brain, Change Your Life is the main book that he has. And I think it's almost everything that's part of his system of his program.
Awesome. I will definitely check that out because I forget what podcast I listened to him on, and I follow him on social media too. And he always has like perfect little educational snippets. And that was pretty mind blowing when I found out about saffron. So expensive, but as a spice. Costco has some good deals on saffron. I'm just gonna throw that out there. But yeah, like now I'll just like little sprinkle in for like a little bit of joy and random dishes. And yeah, I just love how I didn't know that about his wife. So that's so cool. I'll have to check out his book.
And it's so wonderful to watch their journey. And he actually was in Tripler. He was an army doctor. He became a psychiatrist through the army. He did like a lot of reviews of so many soldiers after the war and did PTSD research. So that it's mind blowing, and seeing him come to this place where he has 13 clinics across the country. And I encourage you to go there. It is pricey, but then you get to know your brain better and what is going to be contributing you to have a better life.
Awesome. Thank you so much, Vince and Dr. Mischa, for being here on the World of Nutrition podcast. I just wanted to say that this podcast is sponsored by Mutual Aid Network. So we're really thankful for Mutual Aid Network. They're an organization where they help take people's talents and they spread it around the whole world. So it's really beautiful. Not everybody is able to financially afford different services. So with Mutual Aid Network, they take what your talents are and you're able to trade time with other people around the whole world so you can get things done. And I love that. It's a beautiful organization. And so Mutual Aid Network has partnered with Innovative Nutrition. And just being able to, I wanted to share a recent product that Innovative came out with, actually, that we were talking about, or Vince was talking about today. Innovative just came out with Optimate, which is a prebiotic digestive enzyme that helps support a healthy and diverse gut microbiome to support good bacteria and fight the bad bacteria. There is DPP4, which has been a lot of studies about, that helps to break down gluten and casein. So for myself, I found out I'm allergic to gluten. So this has been a great product for me. Just noticing that before me taking this, I was in desperate need of a probiotic, prebiotic digestive enzyme. And then after a month taking it, when I got checked up, all those issues were going away. And I'm just really thankful. So a few signs of unhealthy gut could be weight gain, obesity, maybe heartburn, food allergies or sensitivities, skin problems, maybe sleep problems or chronic fatigue syndrome, possible mental health issues, and autoimmune conditions. So if you're looking to incorporate a great prebiotic digestive enzyme and support the Mutual Aid Network, please go to man.innov8tive.com, and you will help get your gut healthier and then also help support the Mutual Aid Network in their mission to just help people all over the world. So thank you again, Dr. Mischa and Vince, for coming, and we will see you on the next podcast of World of Nutrition.
Thank you so much.
Thank you, Marilyn.